Executive Media. Focus, innovate, succeed.
Ikop bakube babifanani.
Olikwenda bifanani birungi. Bakukube bakwize ti oli munoni. Omukolo bagukolere.
Olina kwandula.
Olina nankani bya wedding.
Olina graduation.
Ni bobo firirwa. So kwenda kukola nankani send off decent.
Wesimbye omukalulu.
Decent.
Funaba Ikop.
Abo bulwo bayito bataako.
Tubateeko tuli kujja mu kulonda.
Era tibasasula.
Be.
Kale.
Sasula.
Olikwenda bya bululu.
Yes.
Bakukube mukuba ni poster.
Ate bana.
Mukuba poster.
Olikwenda bana.
Bana dinedo kubutundu bali. Mu poster anguli mutunigira muko chali wife.
Ani. Chali wa imazira sente. Yasina n'okumuyamba oyo omusaada. Ikop.
Eri ekindi aba Ikop.
Olikwenda poster.
Kale.
Bana. Butundu bali. Billboard. Jamba na ife aba.
Business card. Mudikola.
Nchenu naba akole ne ya.
Nedo debeta bolochuwa.
Bolochuwa dindi.
Bolochuwa chechimu. Ne business card.
Ate kalenda.
Muwandika ku t-shirt.
Follow us on Instagram at Ikop Photography or call +256 702 935 078. Don't forget, they do it smart. Book with us today.
And branding at Print Creations. From custom gift sets to unique promotional items, creative signages and general printing, we've got everything you need to elevate your brand. Visit us at Chum Towers, Suite 70 on Kuruma Road, Lighthouse, Suites D14, D15 and F13. We offer a wide range of stationery supplies, awards and a vintage collection that stands out. Call us today at 0934 893 333 or WhatsApp 0702 683 317. Follow us on Facebook, Instagram and X at Print Creations. Print Creations, where quality, excellence and uniqueness meet.
The short and big shot.
Omumwa gonfukidde omumwa Zubedah. Candle night ogimanyi. Bagita candle night gwokutte gwobba.
Washuga teyamaliranye ku live.
Pamoja ekiri. Bamu.
Bendera ddala.
Omusajja ate nga anaakuswaza ajja kwana black sugar.
Abasajja munyiga nga tebakati.
N'oyingira n'atakubuuza. Ekibonyaabonya ababooda abasinga. Financial literacy. Oli abeera n'etaano ate nagenda n'akwanamu. Ddala mutabani wange wakati w'emyaka alina okuba ng'ekyalo akikuttemu ekitundutundu.
Anayakola kimpanya n'alagako nno panda nti si wa muzannyo.
Ate kyenayagala ku ttiimu ya Mama Finn.
Sente eziwaayo.
Naye tebasaba njawulo.
The short and big show. Abantu bajaagalira ddala. We always love you.
Hey yo, what's up my people? This is the baddest Azawi right here on Executive Media with RealTime with Mimi. Stay locked in. Yeah.
So doctor, tulina okwetegeka okufuna embuto.
That would be the ideal.
Ata ombuto olufuna bwe weetegeka.
Nedda, that's not true.
Bulina kujja buzzi.
You don't have to.
You don't have to take a mind terujja.
No. But you see, you can take these supplements without the intention into carrying jagala, but you start prepare. Yeah. Folic acid is very important. So we don't take the folic acid on time. Number two, in fact, the advice is you have to take the folic acid 1 to 2 months, in fact, 3 months before you get pregnant, because it's like you ogenda ku sites, then you put your bricks.
Naye mbuto nga tezifuna tetutegedde dokita.
And that's what I'm saying.
So we need also to prepare our minds
yes,
for
prepare your body.
And the mind.
So that when the baby starts to grow, afuna will everything. When the baby is trying to form structures, everything is actually present. Folic is very healthy. We have not come across toxic effects or you've taken too much folic acid. It's a nutrient. Your body stores it. So when you conceive, the baby just forms structures together. That's why most babies who have small heads, spina bifida, and all that is because they didn't take enough supplements, folic acid, in the first week. So why are we getting these miscarriages? Or what are causing these miscarriages? Lack of enough supplements. Our diet as well, we get it. So we come to hospital late.
Yes.
Someone is waiting for the second period. Most people wait for the second period. You've missed last month, and then next month. By the time you've missed the second period, do you know how many weeks you've gone? You're 8 weeks. 8 weeks, most organs have formed. So if you didn't have enough supplements, by that time, the baby has not formed well. You get it? Yeah, so in the first trimester, those are the common causes. Then, of course, there are people that we really don't know, take money. We have done all the necessary tests, and we really can't tell. In the second trimester, we have gone beyond. I have a
lot of questions there.
We have gone beyond the first 3 months. The second trimester, the common causes of miscarriages are infections.
In the second?
Yes, malaria is a very common cause. Infections, could be UTIs, is a very common cause in that time. All right. Then we have also seen underlying conditions in the mother. That can also affect the baby in the early weeks, but also in the second trimester. For example, if the mother gets pressure, she doesn't know that pressure. That pressure can affect that baby from growing. Then the pregnancy fails. Or if the mother has sukari.
Subira buli omu ali bulungi kamera nkula.
Akulindemu omuntu bw'aba akola mulinde.
Wadde ogamba ki wamma? Welcome to the health chat with Mr. Eladu, Dr. Luli. Twakyaza Dr. Martin. Nabeererawo Abakyaala. So women are very happy with transforming from not being with Nyash to being with Nyash. From not being with the waistline to being with the waistline. They are very happy. They are contacting me. But I wanted to go for hips. But I've changed my mind. I'm back to buying a silicone. Hips.
For wearing?
Yes.
Zubedah, give Dr. Martin some work.
I wanted to, but we've talked about it, me and him, and I've totally changed my mind concerning the hours. And he's not scared. You doctors, you're not scared.
It's part
you're
of
not
the training.
Scared of blood. You're not scared of everything. So I'm here with Dr. Eladu. Olunaku olwaleero tugenda kubeera nga twogera ku miscarriages mu bakyala. Omwami bwe tuba twogera ku miscarriage olina okubeerawo sisita bulaza omwana kikuyambeko okubeera nga bw'olaba sayini yonna dokita gy'ayogedde omuddusa mangu mu ddwaliro. Tugenda kumanya ki ekireeta miscarriages mu bakyala, challenge ezijjira ku mbuto ezisobola okuleetera embuto okuvaamu. Tugenda kubuuza dokita ebibuuzo byaffe bingi. Ddi lwe nnina okudduka mu ddwaliro? Ddi lwe nnina okulaba omusawo? Kiki ekisobola okulaga sayinizi eziraga miscarriage? Kiki ekireetera miscarriages? Abamu bagenda mu ssabo banduga nakavaamu embuto 7 tomanyi kiriwo. So leero bye tugenda okubuuza dokita. Interview ewedde nabakolera bulungi Oluganda nali bulungi nnyo. Dokita yeerabira ye n'atayongeramu okwo ku Luganda. But leero ngenda kubanga mmujjukiza. So doctor, how are you? You're looking fabulous.
Thank you, Zubedah.
Yes, and Katangalas. So, olabika bulungi dokita waffe. Saagala kwerabira nti dokita ayina YouTube channel, ayina ne TikTok account. He's new on the blog.
Yes.
Dokita kati, dokita ali mu bano ali ku new curriculum.
Kati kiki ekyo?
Dokita njagala kikugamba. Producer, bano abalenzi abaliko abapya babayita batya? New stock. Yeah, so doctor is in the new stock. Yeah, you have a beard, you're black, you're tall, you have the what? Bakaita batya kano.
Zubedah, tugende ku interview.
So doctor, abantu tulina obakolera. Naddala abakyala tulina obakolera. So doctor, abakyala bantumye leero ebibuuzo byabwe byonna biri ku miscarriage. Abakyala, women are depressed.
Sure.
Women have gone for local herbs. Women are in rehabs for the continuous miscarriages. Miscarriage kye doctor. What is miscarriage? We tuba tutandikira.
So, miscarriage is the English way of saying that the pregnancy has failed to succeed. In developed countries, that word is given when you have reached 5 months or 20 weeks and the pregnancy has failed. That's when they say nti ofunye miscarriage. In our setting or in developing countries, tugamba nti omuntu afunye miscarriage if that person has reached 26 weeks. Before, we used to say 28, myezi musanvu. But now we are saying even at 26 weeks, if the baby has failed to survive or the baby has died before 26 weeks, awo ntugamba nti omuntu oyo ayina ki afunye miscarriage. So that's the English word miscarriage. Naye ffe ku basawo we use the word abortion.
Ekinyiiza nze.
But of course, it's a science word we use into that is an abortion. But the English word is a miscarriage. But also we know that sometimes if you say abortion, people tend to assume that but that's not the case. An abortion is a pregnancy that has failed to survive.
Okay.
Beyond 26 weeks in our setting or beyond 20 weeks.
Ekyo kye muyita miscarriage.
Yes,
So doctor, zino embuto ezivaamu ku mwezi gumu, 2 months, 3 months, they are not miscarriage?
They are all miscarriages. From the beginning of the pregnancy, paka 26, 28 weeks, any pregnancy that fails out, we categorize it as a miscarriage. If you go beyond 28 weeks, then it's no longer a miscarriage. It is what you call a stillbirth, or mwana food munda. That is a stillbirth. Or in our language, tugamba oyafunye IUFD, intrauterine fetal death into mwana afude munda kukuna wana. Yeah. But we don't count that as a miscarriage. We count that as a pregnancy that actually the baby died. Kastanga is said 28 weeks. Now, if it is below that time, tugamba, that is a miscarriage. So you can have an early miscarriage in the first early weeks, or what we call in the first trimester. You can get a miscarriage. Then you can also get a miscarriage in the second trimester. So usually the second trimester extends from about 12, 13 weeks up to 28 weeks. Our second trimester. First trimester are the first 3 months. Over the time you conceive up to 12 weeks. Over 3 months, you're in the first trimester.
Okay.
Yeah.
So Dr. Chichi, what causes miscarriages? Ki ekireetera embuto z'abakyala okuvaamu?
So first, it's really sad when a patient gets a miscarriage. Even you as a doctor, you feel bad about it, okay? Because this is a family that was looking forward to a child,
to have a baby.
So it's a very difficult moment, and sometimes there is no amount of words that can console that person. It's a really difficult moment for the person, for the family, but also for the country. We don't want people to keep getting miscarriages. Now, statistically, 3 out of 10 pregnancies fail statistically. So meaning that there's, in the whole world, there's about a 30% likelihood of people getting a miscarriage as long as someone is pregnant. You get it? So it's something that is quite common. If you're saying 30%, 3 out of 10 women are likely to get a miscarriage, that is a very big percentage compared to a smaller percentage than that. What causes these miscarriages? So again, I prefer to categorize, because there are people who get miscarriages before 12 weeks, the first trimester.
Yes.
Then there are people who get miscarriages in the second trimester after 12 weeks. In the first trimester, pregnancy is an interaction. Okay? When a mother conceives, if the sperm and the egg meet and forms a baby, the very early weeks of the formation doesn't look like a child. Okay? They are just cells.
Yes.
Those are the cells that divide. So, jukira process eyo etandikira mu tubes museke fertilization ebera mu tubes. So that baby, that early baby that has formed must come paka kuna baana. Kulira muna baana. Natuleyo. So that takes about 7 days. From the time fertilization happens, 7 to 8 days, that baby now moves back to the uterus. When in the uterus, that pregnancy must attach muchi munavana. That pregnancy must attach in the womb. So that attachment happens in around the 7th, 8th day of fertilization. Now, this baby that has formed is a foreign body to the mother. Why? Because omwana oyo alina DNA y'abantu babiri. Alina DNA ya taata neya mama. Okay? So your body, God has trained your body to reject anything that is not 100% your DNA. That is how the body is. That's why we bagenda for transplants or kidney transplants. Twinofuna omuntu amachinga bulungi. That's why we look. We get someone whose body or the immune system can match yours, so that your body does not fight that structure. So we don't say until you, or Jangu, I want a new kidney, I pick someone. My body is going to reject it. So we need to look and do tests so that we match. But even after matching, we give that person treatment so that your body does not reject that new organ. Now back to the baby. That baby is a foreign body because it's only 100% DNA ya mama. So the mother must interact no mwana. Bulungi. So the mother will ask questions. We call that at the immune level. Mama atandika kuuza mwana ebibuzo. Who are you? Can you identify yourself? Okay? I'm trying to simplify it. If a baby has formed bulungi, that baby should be able to speak back to the mother. Nagamba neda mkwano. I am part of you. But then Saba, you allow me to stay here for a few months and then I leave. So there is that interaction that should happen between the baby that is forming and the mother to show acceptance of that pregnancy to grow. Okay? So many things can fail that can result into the pregnancy not progressing. So to answer your question, because I wanted us to come to that point, to answer your question, why do pregnancies fail? In the first trimester, over 90% of pregnancies fail because the baby has not formed well. Okay? So if the baby has not formed well, that baby cannot communicate effectively with the mother. the mother will ask into mkwano, can you identify yourself? Gwani, okola ki wano? So if that baby has not formed well, it means that that baby cannot speak back to the mother. So if the baby cannot speak back to the mother's body will start rejecting that pregnancy. Nagamba nedda, you are foreign here. Nsaba ofulume. So 90% of pregnancies fail because the baby has not formed well. So you may ask, why has that baby not formed well? One, could be either the father gave defective sperms or the egg the mother produced was not normal. Okay? Or two, it could be an issue of harmful substances.
Like,
if you're pregnant and you are busy taking medications without knowing that you're pregnant, not all medicines are safe in pregnancy. So some of those medicines can affect the baby from forming well. Okay? Number three, it could be from infections. There are certain infections that can affect the pregnancies from forming well. We've seen
STIs. STIs.
Yes, STIs. We've seen things like syphilis. Syphilis can prevent normal formation of the pregnancy and cause miscarriages. We've seen things like herpes. We've seen, we call them toxoplasmosis. So there are certain infections that we call those infections torches. So some of those infections prevent the baby from forming well. So if the baby doesn't form well, the mother cannot speak with the baby. The mother will want to reject that pregnancy. Okay? We have also seen genetics playing a key role in the baby failing to form well. So as long as the baby does not form bulungi, the mother will not accept that baby to grow. That explains why you don't see so many abnormal people walking on the streets. Because the Walwo system munda, that prevents that pregnancy from carrying on. You get it, eh? Yeah. So, number one, abnormalities of the baby. Okay? Then number two, there are other infections that can affect the baby from growing. For example, malaria in our system, in our setting.
Malaria?
Yes. Malaria is very deadly in pregnancy. That explains why we give pregnant women Fansida.
I was asking, but the tablet is big.
Enaku zino tulina disposable Fansida. Ofuna n'oteeka ku mazzi, it dissolves and you drink. So it's no longer big. You get it? Yeah, but there are such infections, even UTIs. Okay? Because when a mother gets malaria, malaria parasites go and hide in placenta. Kubanga waliwo enough food, enough oxygen. So it suffocates the baby, and then the baby doesn't survive. Infections can cause the same thing, can cause cramps, can affect the growth of the baby. The mother ends up with a miscarriage. Then there are also things like trauma. Taekwondo, the ones who like exchanging off, or people who are really exposed to a bit of force, murubuto. Could be violence, could be maybe you're on a border and they're going through humps and all that. Could be actually lifting heavy things and all that, falling down. Any force to the uterus or in the stomach can actually lead to miscarriage. Okay? So that is that. Then we've talked of the other harmful substances, the drugs that we take anyhow without knowing. And you see, the strange thing is that many people delay to confirm it.
Yes.
Because most of our pregnancies are not planned. You get it? So someone misses a period. Nagamba, kansoke ninde. Maybe the next day. By the time they remember, kubanga, even when they've missed the period, bachagenda mu kibala, bangambe bajanga balina bukanula. So you find that the first weeks of the pregnancy are the most important because that is the time the baby is forming, putting structures together. But also that may be the time you don't know. You're still, you go to the pharmacy and you don't know you're pregnant, you tell the person I have cough, they will give you a strong medicine. India, Turkey, UK, Germany.
UK.
So they will get for you a very strong medicine to deal with the flu, not knowing that there's a pregnancy which that medicine can affect. So most of my patients, I tell them, one, when you know you're pregnant, the first thing you tell anyone is, I am pregnant. If you're going to the pharmacy, I am what? I am pregnant. So that the person gets the right medications. Alcohol is very bad.
Hey.
For pregnancy, yes.
Doctor, that
is not true.
It is a skin routine.
No.
For
so
babies.
Any pregnant people, or people who want to get pregnant, we do not want. But also we know, for example, one of the leading causes of abnormalities muvana is lack of enough nutrients or supplements. Because the baby forming is like you building a house. If you're going to build, you're going to get some bricks, not take house. So when the baby is trying to form, the baby needs nutrients from who? From the mother. And these nutrients are mostly folic acid. For the first 3 months, folic acid is very important. So we don't take the folic acid on time. Number 2, in fact, the advice is you have to take the folic acid 1 to 2 months, in fact, 3 months before you get pregnant. Because it's like you, then you put your bricks. That's what I'm saying.
So we need also to prepare our minds for...
prepare your body.
And the mind.
So that when the baby starts to grow, everything. When the baby is trying to form structures, everything is actually present.
So doctor, do you know Embutto?
That would be the ideal. That's not true. You don't have to. You don't have to. No. But you see, you can take these supplements without the intention into carrying jagala, but you start to prepare. Folic is very healthy. We have not come across toxic effects or you've taken too much folic acid. It's a nutrient. Your body stores it. So when you conceive, the baby just forms structures together. That's why most babies who have small heads, spina bifida, and all that is because they didn't take enough supplements, folic acid, in the first week. So why are we getting these miscarriages? Or what are causing these miscarriages? Lack of enough supplements. Our diet as well, you get it. So we come to hospital late.
Yes.
Someone is waiting for the second period. Most people wait for the second period. You've missed last month, and then next month. By the time you've missed the second period, do you know how many weeks you've gone? You're 8 weeks. 8 weeks, most organs have formed. So if you didn't have enough supplements, by that time, the baby has not formed well. You get it? Yeah, so in the first trimester, those are the common causes. Then, of course, there are people that we really don't know. We have done all the necessary tests, and we really can't tell. In the second trimester, we have gone beyond. I have a lot
of questions there.
We have gone beyond the first 3 months. The second trimester, the common causes of miscarriages are infections.
In the second?
Yes, malaria is a very common cause. Infections could be UTIs is a very common cause in that time. All right. Then we have also seen underlying conditions in the mother. That can also affect the baby in the early weeks, but also in the second trimester. For example, if the mother gets pressure, she doesn't know that pressure. That pressure can affect that baby from growing. Then the pregnancy fails. Or if the mother has sukari, diabetes, that diabetes can affect that baby from growing, not from miscarriage. Okay? There are medications we take because we are having issues. For example, I want to have mental health disorders. Okay, those who have depression and all that. There are certain medications that we take that may not be safe for the pregnancy. So because you take them and you've not come to hospital in time, we can't change those medicines. You get it? Then those can also cause miscarriage. So we are seeing problems in the mother herself, health challenges that the mother is facing that can actually affect that pregnancy from happening. The third one, most pregnancies fail in the second trimester because the cervix is weak. Because because in the first trimester, that baby is still small, child, very, very small. The second trimester, atanika kugeja. So because of that weight, if the cervix has issues, or you've had some surgeries in the cervix and all that, and the cervix is weak, that pressure starts to kunyiga cervix. And we've seen those mothers come, and the baby is coming out, all right, in the second trimester. Then, of course, the usual ones, the trauma, falling down, and all that, those ones can happen in the second trimester, okay? So those are the different spectrums. In fact, most times when I tell mothers, if your pregnancy can go beyond the first 3 months, there are high chances into one year of forming urungi. Because your womb, the mother's body tries as much as possible to prevent those pregnancies in the first trimester from progressing.
Okay, so doctor, second trimester yeriwa bakoma kumeka 7 months.
Yes, second trimester usually goes from about
5
from 3 months, or from the 4th month up to about
7 months.
7th month.
7 months doctor. 6 months. Nina mother yangambye kasita oluweza 5 months nga atandika okweraliikirira because she has lost so far 7 pregnancies, but zimala kuweza 5. She lost her second pregnancy 7 months. Era omwana ne bamugyamu ne bamuteeka mu incubator, but naafa kamuli. Do you know kamuli?
Oh, yes, the jaundice.
Yes, yellow.
Yes. Jaundice, yes.
So she doesn't know where she got it. She doesn't know lwaki yazaala omwana ng'alina. Then the 4th one is badde zivaamu ku 5-6. So she doesn't know what's her problem.
So again, of course, there's a lot of issue that we need to take from the mother. But like we said, if your pregnancy can go beyond the first trimester, then there could be some factors, either mama or factors navana.
Sikutata.
Not necessarily because the baby has not formed well. Okay? Yeah. But now, when someone gets more than 2 miscarriages, 2 miscarriages and above, we say that afuna recurrent pregnancy loss. There's a different way we deal with those patients. Someone who gets, in fact, if you're out there and you've got more than 2 miscarriages, don't just sit, you come, okay? So that the doctors, the gynes, the fertility specialists can assess what is the exact problem, okay? Because the issues can actually be on the placenta of the baby, into the placenta forms but does not support one of continue. So we need to know, are they placental issues? Are they what we call autoimmune issues into the mother's body rejects that pregnancy at a certain point?
At 7 months?
It's
still the mother can reject?
Yes, there's a possibility. There are certain diseases. There's what we call lupus or systemic lupus erythematosus. So it's an autoimmune disease. I don't know how to simplify it, but it's an autoimmune disease that can make the mother to reject, and those people usually they have many issues they could be having allergies and all that, but it's a sign that your body is rejecting or many things. You get it? So there are tests that we do for that patient.
Recurring miscarriages.
Recurrent pregnancy loss, 2 pregnancies and above, don't sit there. Don't wait for them to be 7. Come. There are tests that we do. Then there are special treatments we give that person from the time they have conceived to allow for that pregnancy to continue to grow.
So for her, she thought maybe the sperms of the husband are not okay. Maybe the man cannot give out good kids.
Yes, so, and it's part of the screening profile. If someone gets, and usually when someone gets 2 miscarriages and beyond, among the tests that we suggest to the couple is, can we do a genetic or what we call karyotyping on that baby that has failed, so that we know, was there an abnormality in one oil? If we find there's an abnormality on the baby, then we can also do the karyotyping in the parents, because you may find there that one of the parents has a gene that is affecting the baby from forming well. You get it? Yeah. So people should not take it lightly, and don't just assume that maybe you come with your partner, and the men out there, you should be supportive. You get it? Because for us to find a solution, we need both of you.
Okay.
We need to do certain tests on the mother, certain tests on the father, and sometimes we even advise and say, okay, this pregnancy has failed, but we want to look at that what formed, what was it? Okay, was it a problem with the eggs? Was it a problem with the sperm? You get it, so that we understand what could actually.
So, doctor, in Uganda, we have a disease that they tell every pregnant mother when they get those miscarriages. It is called nabuguma. Ochimanyi? Now, let me explain to you nabuguma. Nabuguma. It is like the mother in the uterus, there is a lot of heat. So the Baganda call it nabuguma, that the baby cannot stay. The heat is too much. So the baby just moves out of the, you get the miscarriage. So they give them local medicine, saying that local medicine can help on that heat. So we don't know, how do you call it in your language? Do you have it?
Zubedah. In my language?
Because it is common. When every woman gets a miscarriage here in Buganda, they will tell the woman, you have nabuguma. Your uterus has a lot of heat.
So, to be honest, I'm hearing it for the first time from
You're hearing it for the first time?
Yeah, but like I said, there are what we call idiopathic causes of miscarriages. Idiopathic means we really don't know. And everything is okay. Check the man, everything is okay. So we don't know, okay, what could happen. And still, there's a way we deal with such pregnancies as well. There's a way we
you also have a solution.
Yes, there's a way we deal with it. Again, of course, it's, you know, when someone gets a miscarriage, it's just natural for them to ask questions.
Yes.
You get it? And sometimes people come up with all explanations too, so that you're at peace. Because sometimes you may think you are the problem. You may think maybe
someone is bewitching
you and all that. So there are so many. That's why it's very helpful that you come and your doctors do the tests. Okay? There are people who have had miscarriages already because of just the blood group. The
blood group?
Yes, especially or if she's blood group negative. Or O negative,
yes,
or A negative, AB negative, and all that. If the mother is rhesus negative, or Aline negative, there is a special injection she's supposed to get, so that the next pregnancy, the body does not fight it and get it out. Dagaleo tujiita anti-D. Okay?
Anti-D.
Anti-D. So that's why when you get pregnant, there are tests that we do, and blood group is very important.
Blood group.
You need to know your blood group so that we can give you that anti-D if you are negative. If you are O negative, A negative, B negative, AB negative. Negative, or you know, for your anti-D. That anti-D helps the next pregnancy so that your body cannot reject it. Especially if the father is positive.
Oh, if you're negative and the father is positive.
Yeah. Now, if you're all negative, then
yes. So we need to know our blood groups.
So it's very important to know the blood group. Because if the mother starts rejecting that pregnancy, then the mother suffocates the baby, stops the baby from growing. And before you know it, that pregnancy fails to actually progress.
So someone there, a lady, when she gets pregnant when she's getting to her second month, she starts spitting throughout
the pregnancy.
And vomiting. But again, sometimes she gets miscarriages, sometimes she doesn't. She told me now she even fears getting pregnant because she spits the whole pregnancy. What is the cause of that over spitting and that over vomiting without even if she told me she gets vominoa, but there is no difference. But she's ever on drips the whole of her pregnancy.
So when this baby starts to grow, there are hormones that are produced by the placenta.
Yes.
There's a hormone called progesterone. that is produced by the placenta to sustain the pregnancy. Pregnancy is controlled by hormones. There are hormones that keep the baby there. Then when you reach the time of giving birth, there are hormones that come and say, Kale, time is up, Furuma.
Okay.
Okay? So the hormones that keep the baby there, the progesterone, tends to usually be very high in the beginning of the pregnancy because it wants to sustain that pregnancy.
Zijja nnyingi.
The side effect of that, those hormones, are some of those symptoms women feel in the first trimester. Kuiranga, they are nauseated, they're throwing up, they have poor appetite, they have too much sleep, headaches, fevers in the evenings, others are bloated, abafuna constipation. So most of the symptoms are associated with those pregnancy hormones in the early weeks, especially in the first trimester. By the second trimester, these hormones begin to level and start to reduce by the third trimester. That's why most women feel better by the second trimester.
Dokita ntafunamu njawulo.
Yes, now there
mpaka kuzaala.
You know, pregnancy varies. First, varies per person. And my patients know that I will tell them that everyone who has ever been pregnant is going to advise you. Kasango funyo olubuto. Everyone will want to give you their opinion. Kolachino. Tamula wenti. Drink this. Do this. Because they think that their experience is going to be similar to your experience, which is different.
Yes.
Number two, each pregnancy is different. I've attended to patients who the first pregnancy assessment from the beginning until the end. The next pregnancy, ayambade lipstick, ngali fine, burunji. She has nothing appetite from the beginning until the end. So each pregnancy is different. Okay? So even for that person, there's a condition called hyperemesis gravidarum. In simple terms, that is a condition that is associated with excessive vomiting and nausea and spitting in pregnancy. And that one, we deal with it differently.
Does she have any solution?
Yeah, so the medications we try to give you, because you see, the vomiting medicines are so many. You get it, right? And especially when you're pregnant, there are those that we pick for you. Because when you're not pregnant, there are other options. But when you're pregnant, there are options that we pick for you. So such a person who is, because when you vomit too much, blood pressure can be.
Yes, bamutekako n'amacupa amala nafuna miscarriage.
Yes. So for such a person, we want, as soon as we notice that you're over vomiting, you're over spitting and all that, you come to hospital, then we manage you depending on that, the severity of that vomiting. Sometimes I've had patients I've kept on drips almost every week until they give birth. Yes.
Dokita abagenda beera watya.
No, all the medicines we give you in pregnancy, very safe. We always Ojaku clinic, they will put you on a drip, give you some anti-vomiting medicine, then you go. There are even others we give supplements for nutrition. We bring the nutritionist on board. What supplements can we give us so that ngafuna nutrients? So it's a team management. See, just guy in your car, we bring the nutritionist on board. Sometimes we bring the physicians on board so that we can keep that pregnancy there until you reach a time of giving birth. So she should not give up. What is very important is that when she notices that, so that we are able to intervene early before it becomes worse. Because if you come when you're dehydrated, by the time you're dehydrated, no more are really dehydrated. You get it? And dehydration affects babies seriously. Okay? Yes, it does. So that's why we want you to be able to hydrate. And sometimes we tell you, even if you can't drink water, take something, take some tea, porridge, juice, hydrate yourself because it is helpful for the baby.
Anti kyalya kyasisema dokita toyimanyi ebyembuto teekayo bw'okizza.
Do you know there are even drips that contain nutrients? See just a mazigoka, but there are drips that have nutrients.
Dokita ogenda muteekako eccupa bakadde emisuwa tegiggwewo?
No, not really. And most times when we manage, you may find that they will take a few days, maybe 1 or 2 weeks without vomiting. When it comes back, and we continue like that because we want to keep this baby alive. So people with such a condition, and I'm very sure there are so many people out there.
Yes.
But don't sit on it. Don't come to hospital late. With pregnancy, as soon as you see a sign that doesn't make sense, jangu kudwaliro. The same thing with miscarriages, for example. When you start noticing that you're getting bleeding that does not make sense, jangu kudwaliro. If you're noticing you're feeling cramps that don't make sense, you come because it could be infections. Yes. Don't wait when it is too much and then you're bleeding heavily, then you come. By that time, we can't do much. Okay? So when you start feeling those things, you come to hospital.
So doctor, ate abantu bemuwa ajja nga bleedinga, mukyala azza bleedinga awulira obulumi, then ne mugamba tuli mugezaako, the baby is okay, ne mother talina kweraliikira, n'asigala nga ate bleeding. Waliwo be mugamba nti kiri normal. Is it normal to bleed when you're pregnant?
Bleeding in pregnancy is a danger sign. It's one of the danger signs that teach patients. Okay? So don't be there or bleeding. It's very important that you come to a scan because there is what we call a threatened miscarriage. The baby is threatening okuvaayo. So don't just sit there and you're seeing bleeding. Of course, in the first few weeks, like we said last time, the first few weeks, there's what we call implantation bleeding. The first 1 to 2 weeks of the pregnancy.
Yes.
Because the babies are touching to the wall of the navana. So that you still have to come to hospital. And we examine you, we do a scan. If the scan says abuli fine, then there are medicines we give you to allow that baby to stay inside there, to minimize the risk of you miscarrying that baby. Then no daya waka. We tell you come back maybe after 2 or 4 weeks to collect scan endala. Sometimes you may find during the time of attaching to the womb, tiwaloka bleeding kekabera around the baby. That bleeding can also threaten the pregnancy. Take it. So we need to monitor that bleeding to make sure that it has reduced. So we know scan as the bleeding reduced. Number 3, the bleeding can be from the placenta. Placenta is what we call that a low-lying placenta. Placenta is placenta is what feeds the baby. So omwana wokubiri Luganda tujita mwana wokubiri. So the waliwo placenta that is connected to the navana. Then no, it is only when you're pregnant. It grows during the pregnancy. So that placenta attaches to the uterus. After that, waluka cord, umbilical cord, that comes from the placenta and ikigenda ku mwana. That's what we cut. So that placenta is not supposed to be wansi kumwagwa n'abaana because as the baby grows, afunawo ka pressure atekawo pressure ku placenta. That pressure can cause the placenta to start bleeding. So that also can be a cause of bleeding. You get it? Yeah. So it's very important that when you see any bleeding, don't stay home. Tukolewo ka scan tulabe mwana akyali fine. You get it? And especially, you see, there are things that we can't prevent. If the baby has not formed well, there is, no matter how many medicines we give you, the body will proceed na rejecting all your mwana. So even us in the first trimester, tuteka kudagala, kumwe dagala, netugamba katulinde tulabe. If the baby can go beyond 3 months, then we are certain that okay, maybe this baby has grown well. There are people who get abnormal babies.
Yes, ngate babazadde.
Now those ones, one, age is very important. The older the person, the more the risk of them getting abnormally formed babies. Okay, so age is a very important factor. Number 2, family history. Has that person got that in the family? So you need to get that history properly. But also the history of pregnancy. If someone has got a miscarriage before, it's very important that in the subsequent pregnancies you consider doing tests. The tests that we can do either in blood or in a scan that you can do to confirm into mwana forms bulungi.
bw'aba tafominze bulungi musobola mujjamu.
Yes, if the baby has not formed well, we discuss with the PID, abasawo w'abaana, and we ask them, eno condition, can it survive or not? If the PID say this baby cannot survive even if you deliver, then we now discuss with the couple. Netugamba kale, mwana ono tagenda kola ki? Tagenda surviving. Are you okay carrying this pregnancy for the next 9 months? Or it's fine for us to stop this pregnancy? There's a provision that abnormally formed babies, you can actually consider stopping or terminating such pregnancies.
Okay.
So you don't have to suffer to carry the pregnancy for 9 months if the baby is not going to survive and all that.
So, Doctor, mu kubeera nga tunatera okuzaala tuyina sayini gye tulaba akubuuza amazzi ogalabye, did you see any sign? Waliwo abaleeta musaayi.
Yes.
Is it normal?
Yes. So there are 3 cardinal signs that show that labor etandise. I hope we shall come back to miscarriages.
Yes. Anti awutubadde manyiira no yaba agenze funa miscarriage.
Nedda. Like I told you miscarriage again up to 26 weeks. Beyond 26 weeks.
Eba tekyali miscarriage.
It's not a miscarriage. 26, 28 weeks, not a miscarriage. So when you are near the time of giving birth, when you see bleeding, okay, so there are 3 signs that can show until labor etandise. Mucus with blood. Because when you're pregnant, the cervix is closed by a mucus plug. Kati when labor etandise, cervix opens and that mucus comes out, and you see it in your panty. The waliwo musayisaayi with some mucus in it. The second one is contractions. Okay? Elisa.
Yes.
Okay? Those contractions of labor keep on intensifying until the baby is born. Number 3 is a mass of quality. We prefer for that water to break in about 37 weeks. Before 37 weeks, one akyali premature baby.
Oh, kati bwe gajja mba nina kuba mu ddwaliro.
At 37 weeks, you make sure you come to hospital because that is a sign of what? Of labor. So, but then there is bleeding, just bleeding, it's just not mucus. When you see heavy bleeding,
yes,
come to hospital because again, there are conditions that can, for example, like I said, the placenta can be down, or even the placenta can detach before the baby is out. Normally, twagala placenta to detach after the baby has come out. But sometimes maybe you're falling down or in a pressure. Some of these conditions can make the placenta to separate before the baby has come out of the womb. Okay. That can cause bleeding. So when you see it, you run to hospital.
Okay.
Kwegamba, bleeding should always alert you. Noja kudwaliro.
So, Doctor, bamaama b'embuto nga olubuto lukula n'asooka n'agenda ne bamukebera pregnant test esooka ne bamulaga you're positive. N'amanya mwa positive, tafuna signs zonna, atalina bimutawaanyiza. 4 months, 5 months temuli mwana, but olubuto lukula. Kati omwana aba ya dissolvinga. What's in the uterus?
So, you have the sperms, you have the eggs, they meet at forming a mwana.
Yes.
When that baby moves from the tube, paka kuna bana, the first thing that baby forms is a sac. The early signs of a pregnancy must scan, what we call a scan, kali round, just black. That is called a gestational sac. Okay? Now, a few days later, on that sac forms another sac called a yolk sac. Then after that, the baby now forms. Or the baby is visible. Scan. Get it? Now, it is possible that pregnancy can stop at any stage. It's possible that the pregnancy can stop when just sac woka. It's also possible that the pregnancy can form when the second sac has formed. The second sac usually represents the placenta. Okay? Then, of course, the baby forms. So, for us, when we do scans, we want to see. Because many people out there who have had miscarriages, we either tell them that the baby formed and it has stopped growing. Okay, that is one of the things.
Yes.
So it's very important that you're able to see a heartbeat on the scan. The very early scan, we want to see a heartbeat, and normally that happens around 5-6 weeks of the pregnancy. If the baby forms no heartbeat, then it grows and stops growing. We say that pregnancy has missed. So that's called a missed abortion or a missed miscarriage. Because I told you the other factors, either the baby didn't form well or infections. Yes. So the baby grew, but because of problems, nafa. So it stops. You get it, eh? Then there are others whereby the pregnancy or the baby stops growing very early.
Before even forming.
Before even forming. You get it. Then there are others where only the placental tissue forms.
They form without a baby?
Yes, but like I told you, there are different ways that this baby forms. Okay? So the placental tissue can form as well. Okay? Then now there's what we call molar pregnancy. Molar pregnancy means that the baby that has formed is so abnormal that it can cause the abdomen to zimba. You will even have more symptoms of the pregnancy.
Yes.
But inside the baby has not formed. All those are different types of miscarriages. Okay? Now, our work is to really, if you're pregnant and you go for a scan, it's very important to see the heartbeat. It's very important to see the structure of the baby. Because the baby can fail to grow at any one point of that journey. And when that happens, then we want to know what has caused it, and then how can we intervene. Yeah.
So, do we have any scenario ng'omwana mwali mu lubuto and the uterus mwali, then also the placenta is also growing?
No, the placenta is supposed to grow with the pregnancy.
Naturally. Placenta ezimba n'olubuto luzimba.
Yeah, as the baby is growing, the placenta also expands and grows with the baby.
So, wasikani bw'akiraba n'angamba ne placenta ezimba tekimpa stress.
No, as long as the baby is okay, heartbeat
yes, the baby is okay.
Heartbeat ready.
But again, angambye ne placenta ezimbi.
It's very unlikely unless the people babies who may have bigger placentas, especially big babies. The bigger the baby, the bigger the placenta, ideally. You get it, eh? So the placenta is supposed to grow with the baby because the placenta is what feeds the baby.
Miscarriage.
Neither.
Sign.
Miscarriage, there is no baby. Other things may be there, there's no baby, or the baby is there, but there's no heartbeat of that baby. Then I will say that pregnancy has failed.
So, mother taina the placenta is
the placenta is expected to be there.
So, there are pregnant mothers abali ku 4 months. Nenga awulira olubuto luzitowa. Like aina pain wano. Taso anakutambula at 4 months. Ebigere bizimbye, taso atambula. Sign miscarriage.
So,
4 months
very good question. So, 4 months, that pregnancy has just come out of the pelvis. The first 3 months, if you touch, when we examine you, there is no baby that we can feel. Kubanga mwana chali mu pelvis. Okay? So within the first 3 months, the baby is still in the pelvis. Okay? Beyond 3 months, the baby now starts to increase and grow. So that's why you are able to see the baby bump. Okay? Beyond the 3rd month, you start seeing the baby bump. Within the first trimester, there is usually no baby bump. So if you're there, unless if that person has fibroids early, or unless if it's maybe a twin or triplet pregnancy, but most times that baby bump is not there. Okay? So it is very rare for you to put it within the first 3 or 4 months. Okay? So if you feel it, come to hospital.
Yes.
Okay? If you feel any discomfort, pain, cramps, come to hospital because we want to know why. All right? There are certain things that...
Because I've seen a mother 4 months, but she cannot walk.
Yes.
She says she's feeling the baby is heavy. Yes, that too
so
much
you
pain.
need to come. Because you may even find that if you're feeling that something is pushing down, you may find that the cervix is weak. And we need to reinforce that cervix. Okay? So as long as you don't feel normal, you're not feeling well, you come to hospital. Let the doctors find out what is the cause and try to address it.
Okay. So, Doctor, kano kaffe k'abakyala. Abakyala bafuna obuzibu ku anus when they are pregnant. Tufuna obuzimba. Not even pregnant mothers only, even other women, but mostly pregnant mothers. But batugamba you cannot operate us when we are pregnant. Buva kuchi.
So as this
kazimba when we are pregnant, olubuto gye lutukoma okukula gye kakoma okweyongera.
Okay. So naturally in the rectum, kubanga rectum is what goes to the anus.
Yes.
Or in the intestines, that towards the end of the intestines, what we call the rectum, then the anus opens. Okay? So every part of the intestines has got blood vessels that take blood there and bring blood back to the heart of what? Of that person. So the rectum also has got blood vessels around it. Okay? Those blood vessels are unique. They don't have, most of them don't have very strong valves. So meaning that sometimes the blood is not pushed back into the heart quicker, and sometimes it can be in the family. Maybe depending on the type of the genes that you have, you may find that in your family, your valves around the blood vessels of the rectum are weak. So if you do heavy lifting, okay, or if you get constipation, okay, or if you do an activity that increases the pressure mu lubuto, that pressure can delay blood leaving the rectum. Then it causes those blood vessels kuzimba. That is called hemorrhoids.
Hemorrhoids.
Kate hemorrhoids, they are those that can occur nebusigala munda mu rectum. Nekatafuluma. Those are called internal hemorrhoids. How can we tell? Sometimes that person tells him, so if I have constipation, I see blood in stool. Nicely about it now outside. See all the pain, but I just I have constipation, I lift heavy things and all that, but I see blood. So then we think, okay, the hemorrhoids could be inside. Then if they are near the anus, or if they've been there for some time, they are pushed until they start to come out of the anus. So when they peep and come out, we call those external hemorrhoids. These others were internal hemorrhoids. These were external hemorrhoids. External hemorrhoids can be affected either because you're sitting or tambula, so you'll be squeezing them and the anus also squeezes them. I will not pain.
Even if you have constipation.
So even when you have constipation, you start feeling pain because now when you go to pass stool, you feel there is something swollen. So pregnancy tends to increase the risk of formation of hemorrhoids because omwana atula awo nanyiga emsiwa. So the blood that goes back to the heart is reduced. So because there's a lot of blood accumulating and delaying to go back to the heart, the blood vessels there zimba. Okay? And so you find that as the baby grows, you may find in the early parts of the pregnancy toina hemorrhoids. But as the baby grows, myezi 7-8, then nekajja. So as the gynes and the obstetricians, what we do, we try to deal with that pain. There are some creams we give you that can reduce the size of the hemorrhoid or that can help control the pain. Okay? The people who deal with the hemorrhoids are surgeons. They're the ones who plan to do the surgeries to remove the hemorrhoids. But we prefer not to do it during pregnancy because pregnancy is a delicate time. Sometimes some of these surgeries can affect the baby, can affect the pregnancy, and then someone ends up with a miscarriage. So we first try to manage it with the drugs, okay, unless if it's really unbearable and too much, okay. But we also know that after you've given birth, Your pressure kendera, that pressure from the baby reduces, so you find that the blood vessels now start flowing bulungi, then the hemorrhoids reduce and resolve.
Okay.
You get it?
Kasobola n'okuwona.
Kasobola n'okuwona.
So Dr. Jim esobola okundetera miscarriage.
Jim, if someone has been active physically before pregnancy,
yes,
the gym would not have an issue with the pregnancy. So most times I ask my patients, have you been exercising before you got pregnant? You can keep up with exercise. Sometimes we just modify the exercise so that they are not putting so much pressure on Embutto. Osigaranga okola maybe aerobics and Zumba and dance and all that. Those are okay. The ones that we think might affect are the heavy lifting.
Yes.
Okay, and those ones we may tell you to tone down or to reduce as the pregnancy progresses. So if you've not been in the gym, we try to. I tell you, please stick to the ones you've been doing. Okay, don't start a very strenuous exercise plan because now you're pregnant or you are thinking, no. There are other exercises that we can recommend. We can work with the physiotherapists. They can advise you on the things you can do that can help improve the chances of pushing. But then going to the gym, then not a treadmill, strenuous activities, that can be harmful to the pregnancy, and we wouldn't want to encourage that.
Okay.
Yeah.
So is ekigaji bakiyita batya mu Luzungu?
Chigaji.
Aloe vera.
Aloe vera, yes.
Is aloe vera cooking oil help me in pushing? Doctor, we get a lot of advices when we are pregnant.
Yeah, and it's very important that sometimes patients come and tell me, they've told me to drink this, to do this, and you see,
when you see labor signs, take this. You're going to spend only 5 minutes.
Which is not
to
true.
Push.
Some of those things are coincidental. Someone got maybe a cup of chigaji.
Yes.
Then they push. Then now they say, yeah.
Chakola.
Yeah. So again, your doctor should be able to. The antenatal journey is very important to all pregnant women because that is the time we are able to discover if you have a chance of pushing or not. The antenatal journey is very important. There are people whom we don't even. Yes. We just tell them the best way of you giving birth is by C-section. All right? For example, there are people when they're about 38, 39, and we realize that your bones are tight, it would not be practical for you to push. Why? Because we know that even if you stayed in labor for 1 week, so we advise you, if you, for us we plan operation. Okay? There are sometimes conditions that the mother has that we know that pushing will be harder for that mother. Okay? The mother has maybe a heart problem, something, get it? They have a hole in the heart and all that. We know pushing may complicate that condition. There are mothers who have had fractures, pelvic, magumba, the pelvis. They have had a fracture, it was repaired. We think that this person pushing is going to, yes. So the antenatal is the time we're able to discover some of these things. Speak with your doctor, explain yourself to them. Let your doctor know you so that is able to what? To help you. There are mothers who have been operated more than once. They've had 2 or 3 operations.
Yes.
Those ones we tell them, don't even try because it will be harmful. It will be more risky for you. Then there are mothers that we can check. Let Ugambo or no. And I'm going to give her all the chance to push. You get it? During the antenatal, there are exercises we will recommend you to do, okay? Especially exercises to relax amagumba gachi of the pelvic area. Exercises to relax the muscles. Because again, the other thing we want to reduce is the risk of getting tears. Sindika baby. You get it. And then the exercises you can do, physiotherapist can advise you into collachino. There's what we call the perineal massage. So we're massaging those muscles gali mu vaginal area to stretch them so that when the baby is stretching those muscles, it is not tight. The baby can actually come out. All right? Yeah. So those are things that we do during the antenatal. So my emphasis is please attend the antenatals. Ask as many questions as you can to your doctor. Tell them what you have heard, TikTok, what your neighbors told you, and ask if it is safe for you. Because some of these things are just rumors and they're not backed scientifically.
So Dr. Byonna byenda bitino bane sente. Because now physio wa bay and stretching at the amagombo mwana ayitewo.
So yeah,
we need money.
Well, but you see, healthcare, I think our challenge is that tetufuna enough time with the doctors.
Yeah. Sometimes we fear the gynos.
Yes.
We don't tell them the truth.
No, you should not fear. Because this person has the responsibility of helping you during this journey. We are trained to help you during the journey. Get it? That is what we have gone to school. That's what I've gone to study in school. So, and for me, the person in front of me is very important. If I'm talking to you, I don't really mind because I know that you are very important. So I need to give you as much attention as possible to also address your issues. Because when I educate you, you'll go and educate other people. So most times I take time to just explain to the patients so that they understand what is happening, so that they are able to know what is right, what is wrong, what they can go with, what they should not go with. Okay? And of course, we're still, regarding miscarriages, when it happens, it is not the end of the world.
I can try again.
Yes, you can conceive again. And because I think we haven't brought it out, that when you have a miscarriage, the most important thing is that, is everything out or not? So the scan is able to show us into whatever has failed Munda has come out. Or there are still some things that are left in the womb. So if everything has come out, then we advise you and ask you if you plan to conceive again. When do you plan? Do you want to start preparing for that conception? We give you an advice on that. If there are things still left inside, then we want to know, can these things just come out with medicines? Or what we know, theater and we clean, we remove those contents. Because if you leave those dirty things, or infections, and you get past, and you can even lose your womb. Okay? Yeah, so when it happens, what you do, just come to hospital. Your doctor should be able to discuss with you and tell you these are few things. We don't have to go and clean them. Just a dagala, and then maybe cover with some antibiotics and all that. You come back and always come back for review, because the review is come back for review so that we're able to be sure and everything is then we can plan for that. Sometimes we conceive when we have not planned, and after that we discuss with you and say, do you want a family planning option? Or if you want to try, how soon can you try? Based on how you have recovered, we can tell you to try in a short time, or we can tell you to give it some time. Then you try again.
So, Doctor, have you thought of do we have sessions here for those mothers experiencing miscarriages?
Yes. So we have a support system. We actually have a psychologist and a psychiatrist, okay, who really, and the benefit, you see, when we're dealing with miscarriages, there's the physical pain that you get from the bleeding, the cramps and all that. And me as your gynae, I will take you through that, manage the miscarriage. But then there's the emotional pain that you have. And that one, we connect you to the right professionals, people who are trained to counsel you, to help you go through. And sometimes you need support. May it be from us. Sometimes some people think they're very strong. But this can, I've seen many people get broken, many people have got disappointed. So reach out and get this help. This help can be in the form of your family, can be from the professionals. Okay?
The bullying from the community, doctor. They face a lot of bullying from communities, in-laws.
There's a lot of stigma. But we approach it from that point. There's a physical pain, then there's emotional pain.
That emotional pain.
That we really address. And most hospitals should be able to do provide this emotional pain. Because I know sometimes as a doctor, you have many patients. So you may not, I need someone just wants to talk. You get it? They want you to listen to them. So let us be able to recommend these people to the right professionals who can give them time and listen to them and manage that emotional challenge that this person is going through, and together with the couple. Sometimes we think men are strong, but I have seen men who have broken down to the point because the wife had a miscarriage, to the point that they even don't think they will conceive again. You get it? So even the men out there, don't just sit, because some men even end up blaming the wives. Someone has had a miscarriage, then you're there, you're bitter, you think it is the wife who has caused it. It's not the case. But let us direct these people to the right professionals, bafune that emotional and mental support.
Okay. So katuberekereze Dr. Tumuleke olunaku olwaleero abaako duty nga abalwadde bamulinze nga abakyala bamulinze. So go wenna ali eyo ng'olina obuzibu bwa miscarriage, you can come to TMR, ask for Dr. Eladu. Asobola okubeera ddala bw'oba naddala weetaaga ka emotional support. Some of them need the emotional support. Some of the ladies are already disappointed. They don't know whether they can conceive again. Babivako, they are willing to adopt. So maybe you can come here and get some emotional support. Then Dr. Sokuwa esuubi eddala ate n'ozaala munnange. Tomanya, try your best. Health chat tubeerawo buli lwakubiri, katubeerekereze musiibe bulungi, mweraba tubadde ku TMR.
Thank you.
Executive Media. Focus, innovate, succeed.